Some audience participation. There's a little word up there. I want you all to pronounce it because that's what you're supposed to remember. This talk is about trends, and the word is SoLoGloMoGaBi. Can I hear that from the audience? SoLoGloMoGaBi. Okay. So now I'm going to say that as you have just heard from the patients and the physicians, what are we doing in life? It was Sarah who mentioned that, and Len, and I guess all the patients, that we're not immortal, but somehow we're always on a quest to go beyond ourselves. I think that that is what we who work in healthcare social media get out of this. Why do we put so much effort into it? Is that we found something that is larger than ourselves. And people have always been on this. This is a medieval the quest for the Holy Grail. What was the quest for the Holy Grail? But to get on a road that would have many challenges, many difficulties, and somehow get to the end and slay the dragon. But even though maybe there was an individual who was going after that dragon, they never were really all that alone. They were part, say, the Knights of the Round Table. Was this one of the first physical examples of social networking? And there have been many roundtables since then. To bring us back to the subject of social media, let me show you this roundtable, and let me spend a second talking about it. Maybe many of you have seen this picture in the news or on the web. It was when President Obama contacted all of Silicon Valley. Now, Larry Chu wasn't present, but the president of Stanford was. And this is the whole ecosystem of social media. What is it about? It's about an amazing challenge. For some, it's the money. For some, it's creating something enormous. And we have here, of course, healthcare with Genentech, which was the founder of biotechnology, in some opinions. We have many of the investors. But we have all the names you know and that we're talking about today. We have Google, Twitter. We have Apple with the iPad. We have Yahoo. And others, they were all there at this roundtable. It's such the importance of the social networking ecosystem. And of course, given the current events, if I didn't mention that Facebook had pulled off the third biggest IPO in the American stock market history, this wouldn't be complete. And yet, their quest is far from perfect. After the first day, they were down, or they were left with only 23 cents on the stock, and I believe now that it's around 31, and that there may even be court cases about improper practices with respect to the sale of the stock. So the amazing, mighty Facebook is on a quest that will never end either. And so let's get back to that word, SoLoGloMoGaBi. What does social mean? In French, social means something else besides the usual word. It's a reference to part of the healthcare system and social insurance. But for us, it's social media. And there are so many of these. On here, you have all the logos. And for example, on the bottom right, you have the logo of Pinterest, which for many people came out of nowhere. Also on the bottom, you see an old-fashioned camera. That's Instagram that was bought by Facebook. These two made big headlines this year. It's a huge universe and something that is really a full-time job to keep up with. It's a quest to keep up with it in and of itself. But what is it about? Why is it so popular? It's so popular because of engagement. And engagement has taken on a slightly different meaning. If you go to Wikipedia, you will see a 19th century photo of an engaged couple. It's not so different, but it is a little bit different. Engagement now means contributing. It means that it must absolutely be the end of the one-way communication that we were so used to since probably the beginning of the printing press. I would say that before that, people were forced to talk to one another. But then for the 500 years from the printing press until the web, we went into one-way communication of talking at people. And this chart shows all the ways that Facebook engages people, beginning with the like, of course. Local. So what does local mean? Local means that it's everywhere. It's a paradox, because local means it's right here. It's right in this spot where I'm standing with my cell phone. They can locate me. But that also means that it's everywhere we are, which means with this geolocation that it's 24/7 and that we are never off. Even when we're taking a bath, we can be contacted or working, depending on the quality of your equipment. And it's global. It's so fascinating that it's local and global. And why do I say that? Because all of these brands have made their way around the world. Facebook is in the top 3. Google is #1 around the world. YouTube is in the top 5. And Wikipedia is in the top 10 in every single place. And this may surprise the Europeans in the audience that today, Europe is the largest population on Facebook with the numbers that you see, surpassing North America. And given that, as far as I believe, it's difficult with Facebook to get beyond 50%, the growth now will come from all of the others, from Europe, from Asia, South America, etc. When I said global, just imagine if Steve Jobs had not thought globally, if he hadn't had that amazing, wild ambition to go around the world. You could not have had the investment and the platforms that can result from the iPhone and the iPad if we were there with 200 versions. I mean, look at the problem with the electric socket, because all of that was developed before people had the idea of global. So we've done SoLoGlo. We're up to mobile. The trend in mobile is that by the end of this year, and Social Media Today is one of our proud partners, we will have as many mobiles as people. Now, it's because in certain places, people have several mobiles, as maybe some of you have, one for your work and one for your personal use. But the presence of mobile is overtaking everything. And in fact, what people are doing on mobile is no longer speaking. I'm sure that many of you are on your mobile devices right now with 200 million YouTube videos played every day mobilely, with people doing searches more and more. And the searches are local, so we're in that SoLoGloMo. And games. I played with the word to say ga rather than game. But gamification, which is slightly different from games, gamification means using motivation to change behavior. Ever since you were a child and they said, if you do this, we'll give you that, we've been programmed, and maybe we are wired to work in this way. We work towards encouragement. So whether it's that little bar that comes on your computer or the circle on a Mac to tell you that you're waiting, or whether it's the stars and badges that you can get, gamification is becoming a way to make us move forward in things that have nothing to do with simple games, in things that are serious. That's why we say serious games. And this is not reserved to the young children of Bart Brandenburg. 82% of people using serious games are over the age of 18. There are more and more women, and they are even amongst the elderly, as this person playing with a Wii. And it's quite often on a mobile device. You have a few minutes, you get on your device to play a game. So what is all of this doing? As we saw yesterday in the big data session, this is generating a huge amount of data. And thanks to software ability, we can use this data and present this data in a new way. It looks like a beautiful design. Yes, it is. It's visualization of big data. What is that? It is points being connected. We will come back to that later on the healthcare side, but it's points being connected, and with the colors, you can see, for example, that whatever it is that we're showing, where it is pink, they all have a link. Where it is blue, they all have a link. And so this enables you to understand what that data means and to find new things. And that is why governments are opening up. You have on the left the American one, or UK, and on the right you have the French. The idea that government is holding our data and they're giving it back to the people and back to programmers through challenges that are being run around the world to find new meaning in data. It's true that this is science in a different way. This is science by serendipity. It used to be, let's say, for most of the 20th century, we supposedly became very rational and felt that we had to know first what we were looking for. Now we find things before we know that we're looking for them. And so in healthcare, what is this quest? Well, we've been seeing that the quest is for the patient and the physician to get together in new ways. But if we look at it socially, we've been using technology to go from what we had in the early days of the web, where we used email lists and forums and personal pages, to then forums on portals was the second step. The third step would be when Facebook came out and people started creating public or private groups. On YouTube, communities form around videos to comment about healthcare questions. And finally, as we saw this morning from both Sarah and Bart, we saw about tweet chats, the latest use in developing community where you don't even have to start from opening a new account. You use your existing Twitter account, and you can be in many different medical communities. All thanks to simplification of technology. It no longer requires knowing about programming. The issue is that we have two different points of view. The physicians and other healthcare professionals are generally using these sites to communicate with colleagues about professional issues, and they want to have a private space to do so, whereas the patients want to go out there and share with everybody, and maybe not always speak with physicians. They want sometimes to just speak amongst themselves, but they also want to share their knowledge, and we'll be talking a lot about that. And so when we look at the tweets, I looked here at Digestive Disease Week, which takes place every year in May in the United States. When you look at their hashtag, it is physicians speaking to one another. And when you look at Sarah's FMD chat, here are a couple of patients talking to one another and thanking one another in a very warm way. It's quite a different conversation that I found. And if we go local, so what is happening? We did a study, the poster is out in the other room. We found that, for example, in diabetes, if you were going to work in French on diabetes, you could find as a patient 13 different forums in French. Would you want to eliminate the Canadian one if you're living in France? Probably so, because you wouldn't have the local information, but at least the language would be fine. The NHS came out with a very interesting local mobile application helping the British find the services near them this year. So that's a little plug for NHS, if they're tweeting with us. And I love this application because it was the first one I'd noticed. I know there are many like this around the world. I, right now, can get on my iPhone and see the number of minutes to get in if I go to the emergency room at Newton Wellesley Hospital. There is actually even a portal that I saw called iTriage. It's a portal and a mobile application that encourages hospitals to have a spot so that they don't have to develop the technology and they can let patients know what's the waiting time at that emergency room. And globally, I'm going to go back to this. So Bill Gates Foundation set this chart up. It's a Twitter chart by mapping who is tweeting to whom, who is connected, who is following whom. You can tell whether a public health message can get through. Just look at the emergencies that we've had with whether Fukushima or with H1N1. If you could know that your Twitter network is fully linking everybody who has to be linked, you can be so much more efficient, and you can fill the gaps so that in a crisis, you can really get your message out. This was done well also with Born HIV Free that got 700,000 signatures before a World Health or other organizational meeting to approve funds. Mobile in health. This is the Mayo Clinic. Mayo Clinic spoke at the conference last year. They just launched an app for each individual patient to be able to see their file online, their electronic medical record, which is the equivalent of the DMP, and also be told all the information they need as they arrive for the exam. This is the IBG Star, which is an accessory for the iPhone that was presented recently by, with the help of Sanofi and iPhone working together, so that the patient has an accessory to take their blood and get their glucose measure. It's absolutely fabulous, and we'll probably talk about it again, an interesting partnership with pharma. Last year, Lucien Engelin said that he tweets his weight. And that was maybe surprising. Now it is more common. He has an electronic scale. You have here a connected blood pressure measurement. You can watch your baby from a distance. These are all from YThings, who last year was one of the finalists winning our startup contest. This is a fabulous iPad application. If we could have, we would have shown you the video. With this application, the doctor can slide his fingers on the graph. He can ask for the previous electrocardiogram, and he can zoom in to the waves that you see here from each of the 10 electrodes that would have been on the patient's body. This is immeasurably better than having a paper electrocardiogram, immeasurably better. That is why, amongst the many reasons, 62% of American physicians love and have their iPad. It's about half in Europe, and since the United States is always a prediction for the future, come back next year here, and I'm sure we'll have a similar percentage. And the doctors are now making the fashion news with their $31 iPad pocket coat. If manufacturers are manufacturing coats with the iPad pocket, and I knew it because I saw a tweet with some doctors saying, who could help me sew my pocket? I figured somebody's out there selling it. I went to look for it. And with health games, Heartville was invented by a Dutch psychiatrist who knows that there is an incredible loss of life amongst depressed patients because of poor lifestyle. And so with this serious game, which won a prize in the Netherlands last year, you can improve and encourage life, really gain life expectancy for depressed patients. There's a tremendous amount of good work going on in the Netherlands in mental health, using the web between physicians, patients, and other healthcare professionals. And Stanford, Larry, so Stanford has a game that gives continuing medical education credit to professionals. It's called Septris, and there's a Dr. Septis in Septris who explains about septicemia, and people get points and continuing medical education points for playing this game. So we now are back to big data in healthcare, which is the quantified self. We will talk about that again later, but it's all this collection of data that creates those huge data points that we saw. Look what you can do with this. This is a chart about blood pressure and the treatments. I can push that little scale on the bottom that says 18 to 90, I can push it to 80 years of age, and I can look at the population and see that they are taking a different sort of treatments than the average population. And this is available on the web, and it could be on your iPhone as well. And so, SoLoGloMoGaBi, you can come away knowing that there are 6 trends in social media that you should know about, in general and in healthcare. But so what? So what is that we have to get off the divide. We have to get off the separate paths between those that do and those that don't, between traditional and modern, between the professional and the patient. We have to, and we can, because there are so many people who are already doing it. It's not as though I said no one is doing it. All we have to do is push the pointer further so that those who are already doing this will be doing it more. And so what needs to happen is that we need people like Jennifer Dyer, who invented this app for patients that she'll be telling us about later. We need patients to get on and be motivated to use these different tools. We need professionals to prescribe them, whether it is the IBG star or many, many other possibilities. It could be information therapy, mobile application therapy. I'm sure that all these words will come out. And I take my hat off to Dr. Lucas, who will speak at the end from the French Order of Physicians. They put out a white paper that explains that physicians, that was directed towards physicians, must help bring the web to be in better service to both physicians and patients. Because SoLoGloMoGaBi, if we all collaborate and we do this in a community way, we will improve care because all the data will be where it has to be. Thank you very much.